Hello and good morning, everyone. Thank you for joining us. I'm so happy to be here along with our Minister of Finance, Peter Bethlenfalvy, in my riding of Etobicoke Centre, just a wonderful community for families to live in. In June, a short 5 months ago, the people of Ontario sent us a clear message. They want our government to continue the critical work we are doing to build up this province and continue to do everything we can to make life more affordable. Today is my pleasure to introduce Minister Bethlenfalvy. Since 2018, this minister and our team, led by the Premier, have never wavered in our commitment to the great people of this province. I am happy to join him today as we build on our promise to Ontarians. Thank you.
Well, thank you, Minister Surma, and it's great to be in Etobicoke again, and welcome to Etobicoke, Premier. I know you live here, so my parents live here, so I'm going to join them for lunch, so thank you for hosting it here in Etobicoke. You know, with rising prices of everyday goods and services, there is no question people are feeling uneasy about their personal finances and the economy. Our government is taking a targeted approach to support families and businesses during this time. We eliminated license plate renewal fees, as well as license plate stickers, and refunded the past 2 years of fees eligible vehicles. We've also provided tax credits and benefits such as the Ontario Child Care Tax Credit, the Low-Income Workers Tax Credit, the Jobs Training Tax Credit, and the Seniors Home Safety Tax Credit. These are just some of the actions we have taken to help people with financial pressures. Ontario, like the rest of the world, will continue to face economic challenges in the months ahead. Tomorrow's 2022 Fall Economic Statement will take a targeted, responsible approach to advance our plan to build, while also preparing for any challenge that may come our way. Now, while this is a challenging time, I'm confident in Ontario's economy, its workers, and its people. Now I'd like to pass it over to the Premier, who has some good news to share with families. Thank you.
Well, good morning, and as Peter said and Kinga said, welcome to Etobicoke, and just want to thank the folks here at Esso and Circle K for hosting us today. It's a little chilly out, but thank goodness I got a couple layers of insulation. And thank you, Mr. Bethlenfalvy and Mr. Surma, for being here today. As the Minister was saying, when we talk to the people of Ontario, we hear the same thing. It doesn't matter if you're a construction worker, a taxi driver, a small business owner, a senior living on fixed income, or a newcomer to our province just starting their career. Everyone is concerned about the same thing, and that's how expensive life is getting for them. From gas to groceries, prices are higher, and that's putting real pressure on household budgets. The fact is, people need a little bit of help. That's why this past summer we cut the gas tax by nearly 40%, saving Ontarians 10 cents per litre of gas. That was real money back in their pocket, giving them some room to spend more on the things they need. And today, we're announcing our plan to extend that tax cut for another year. Tomorrow, we'll introduce legislation to extend the gas tax cut for another year, delivering some needed relief at the pumps for drivers and businesses for one more year. Extending the tax cut for an additional year will mean the average Ontario household will save $195. We know that every dollar helps. And this gas tax cut is another way we're delivering savings to Ontario households. From permanently removing tolls on Highway 412 and 418 and eliminating license plate sticker fees, we have taken concrete action to make life more affordable for Ontario families. But my friends, we know there's more to do. We must stay focused, and we can't take anything for granted. As we navigate global economic uncertainty, our government has been hard at work, building an economy that can weather any storm. Any economy that never loses sight of what's most important: helping people succeed, helping workers succeed. That starts with creating the economic conditions that attract investments in growth and good jobs. We've cut red tape to reduce the cost of doing business in Ontario by $7 billion annually. We've kept taxes for people and businesses low. We're investing in the skilled trades and a workforce that's prepared for the jobs of today and tomorrow. We're building roads and highways like the Bradford Bypass and Highway 413 that tackle gridlock and get goods to market sooner. We're making investments to improve the province's competitive advantage, to ensure that Ontario remains the greatest place anywhere to live, work, and raise a family. And while the world faces economic uncertainty and our challenges with inflation are not over, one thing I have complete confidence in is the people of Ontario. There are no harder working people on earth. And I know that together we will accomplish incredible things. Together we will build Ontario. Thank you, and God bless the people of Ontario.
We're going to take questions from the media. If you could just line up behind me, it's one question and one follow-up.
Premier, good morning.
Good morning.
I'm right here.
There you are.
Hi.
Sorry.
Thanks for doing this. Thanks for taking my call.
No problem. I apologize for waking the media up out of bed early on a Sunday. I feel terrible.
I'm not sure you're going to like this question up. I'm going to ask you.
That's
so
fine.
I apologize to you. The notwithstanding clause, sir, that your government implement or was planning to implement this past week, given that during our democracy, that is the most heavy-handed piece of legislation that the government can use. And given that it was going to be used perhaps against 55,000 workers who were the least paid workers in the education system, and they pushed back. And were you concerned, do you regret uttering those words because they have pushed back? Had they not pushed back, negotiations would have continued, or they would have faced fines, and those fines would have been hefty, and that would have made the government look bad by giving those hefty fines to those workers. And if they defied it like they did, and you rescinded that, does that make the government look weak? Like, what's your feeling on that whole?
Well, thanks so much. And as I said before, in negotiations, you got to give and take, and that's exactly what we did. The most heavy-handed thing you could ever do is walk out on kids, walk out on parents, stall the economy when they're supposed to be at work for 55,000 people. That's heavy-handed. And as for Section 33, do I regret it? No, I don't. It's in the Constitution. It's a tool that is used by provinces across this country. And just one example is Quebec. They've used it, 22 times or something? But anyways, no. All I'm concerned about is one single thing, is keep the kids in the classroom and, protect them, number one, support the parents, support the workers, and make sure everyone gets to go to work.
What if these workers continue and they go on strike and they push back? If this legislation were to be implemented, you are forced then to act if this legislation is passed. And that would require heavy fines on the poorest of workers, which optically would be terrible. And if you didn't, it would make that threat of that legislation look weak. So I'm just trying to understand, do you feel like you're backed in a corner now with this negotiation?
You know something, the mediators asked us not to get into details. So I'm going to respect the mediator. And let's just hope that the kids are in class. The good news is, folks, this is the good news. We're at the table. The kids are back in class. The parents get to go to work. Those are the three things that matter. And we're able to make that happen.
Thank you.
Thank you.
Morning, Premier.
Good morning.
Liam Casey with the Canadian Press.
Hi.
So Dr. Moore is set to recommend masking to the public tomorrow to encourage them to mask up.
Yep.
But your government's not going to mandate mask wearing. I spoke yesterday to the CEO of Sick Kids who would welcome universal masking. He says his hospital is in crisis. He says all the other children's hospitals are in crisis at the moment, and he would really benefit, the children would benefit from masking.
Yep.
Why won't you mandate masking?
Well, I follow the direction from Dr. Moore. I've said that from day one. Dr. Moore will be out tomorrow with Dr. Simpson. We have experts all over this right now. We have, as I mentioned, Dr. Moore, Dr. Simpson from Ontario Health, along with Matt Anderson, along with Dr. Zahn, the Deputy Minister, and let's not forget Michelle D. Emmanuel that ran Trillium Hospital as well. I was in conversations with 7 hospitals across Ontario on Friday. I spoke to every single CEO. We're pulling out every single stop along with them to make sure that we have the capacity to handle the flu season. So I just, a couple things. Wear a mask every time possible, number one. Number two, get a vaccination shot, and if you haven't already received yours, and get a flu shot. So those are the recommendations I have, but I have confidence in the system that yes, will there be bumps in the road, and we're working on solutions every single day. They're being very creative. Each CEO that I spoke to, they're thinking outside the box. No matter if it's CHIO up in Ottawa, bringing in orange paramedics, highly trained, and or just making sure that we continue to hire more nurses. Folks, this is what it comes down to. We need more doctors, more nurses, and we're doing both. Making sure that we build the infrastructure that we're doing. We're spending $40 billion on 50 additions, and I wish I could snap my fingers and add more hospitals immediately. But it was from decades of neglect that we're in this position on the capacity, and we're just going to continue building. And that's going to maybe take a couple of years, but we're going to continue doing that, investing into healthcare. We're investing more money into healthcare than any province in the history of this country, and we're going to continue doing that. We've brought in the system through the College of Nurses over 14,700 more nurses this year alone, and that's more than we've ever seen. We're bringing more doctors online. We're building a medical university. We've added over 3,100 beds. We're bringing on another 3,000 beds. So we're doing quite a bit.
But the CEOs are asking for mask mandates. They can help in the short term. But why?
Well,
are you?
Yeah.
Why won't you?
Yeah. Again, I'm going to follow Dr. Moore's direction, and seven hospitals that I spoke to, CEOs, yes, they want masking. No one told me they wanted mandatory masking, but in saying that, I encourage every single person, when possible, especially people with respiratory problems, young kids. What I heard from the docs yesterday, a big problem are the kids that aren't in school, the 4 and unders. That's the situation. I've also heard that with 16 and 17-year-olds out in Hamilton, they're going into the adult care program to free up more beds. It's all hands on deck right now.
Hi, Premier.
Hi, Cynthia.
I hear what you say about the capacity that you're trying to build, and I acknowledge that you inherited a hospital system that was already cracking at the seams. However, there aren't enough ICU beds, pediatric beds for children. Parents, of course, would be absolutely devastated to see their young children so ill and not necessarily getting the care in the hospital in the appropriate bed that they need. Mm-hmm. And you are the person in charge right now. How do you explain that there are not enough pediatric beds today when you've known for months that this could be a really rough season without masks and with all the additional respiratory viruses in addition to COVID?
Well, thanks for the question, Cynthia. And we've been working not just months, for the last couple of years throughout the pandemic to build up the capacity. We're, again, pouring. It's not a money issue, folks. We're pouring billions and billions of dollars into the system. We have a great team of CEOs that are thinking outside the box to increase the capacity when it comes to pediatric beds. Every CEO said this one thing in common, and I always take what everyone's saying the same thing. We need the pediatric docs in the offices. Right now, I get it. Virtual is okay. Even 20% of the time, but we need more family health clinics, number one. We need the docs to be in their office as much as possible, not 50 or 60% of the time, because at the beginning of the pandemic, we saw it decline, but we haven't seen it ramp up. There's also a strain on Tylenol and Advil, which the federal government has to step in and start working with the providers in the U.S. to bring more Tylenol up. And I know it's a packaging labeling issue as well, because the French-English situation. Let's bring it up. It doesn't matter what's on what labeling's on, as long as it's safe, it's coming from the producer, be it Advil or Tylenol, will help out. But these are some of the factors that are causing some of the issues. Not all of them, but a good chunk of the factors.
But Premier, with respect, you're the one in charge. You say we need doctors to be in their offices. Why aren't you making that a reality? And we have shockingly few pediatric ICU beds. I mean, did no one see this coming? Did no one think, a year ago, 6 months ago, we need to ramp this up?
Well, what we've done is ramping up the total capacity, Cynthia, and thank you for that question. We are moving with the pediatric docs, family docs, getting them back in the office more than what they've been in the past 2.5 years. We're throwing resources by hiring more nurses, and it comes to an HHR problem, health human resources. But no one has ever hired more nurses, graduating more docs than what we've been doing. So we have been ramping up. We have a strong plan, and between Dr. Moore, Dr. Zahn, the Deputy Minister, Dr. Simpson, Matt Anderson, all the CEOs of all the hospitals, we've been in full communication.
Hi, Premier Dustin Cook with the Globe and Mail.
Hi.
You just said it's not a money issue when it comes to the healthcare system, but recently the FAO issued a report that said the province is forecasting to spend less than they would need to meet the programs it has planned. So will there be more action taken, maybe as early as tomorrow? What can we expect to see in terms of addressing the increasing challenges?
Yeah, I didn't hear which hospital said that?
No, the FAO report.
Okay, the FAO report. Well, that's a snapshot in time. They always do this. It's just not accurate. They take a snapshot in time, they don't look at the whole year, and they do this constantly. Folks, make no mistake about it. Go online, look at the budget. You're going to see we're well spending in excess of, I think it's $5.5 billion. And this is a good question for our finance minister. He has these numbers down pat, but unprecedented spending on healthcare, and no one can argue that fact. Matter of fact, of the 7 CEOs I spoke to, not one single person said there's a money issue, no matter who I talk to in the health. But I'll pass it over to Finance Minister.
Well, thanks, Premier. Absolutely, we're investing unprecedented historic amounts in our healthcare system, but not just our healthcare and acute care, but also in long-term care, in community care, in home care. I mentioned my parents, who I'm just about to go have lunch with just down the road here in Etobicoke, and they get care at home. We put in tax credits for seniors so they can age at home longer with infrastructure and home attendant care. So we're investing, not just in infrastructure, as the Premier said, but we've put money in the budget, which supports healthcare, human resources, hiring unprecedented amounts of nurses and personal support workers. The budget and the previous 2 budgets, we put the first medical schools in over 50 years in Brampton, a new medical school in Scarborough with the U of T, a creative medical school in Lakeridge and Durham with Queen's University to graduate more family physicians. So, as the Premier said, the money is there, the investments are there. They were long overdue, neglected for decades, as Cynthia mentioned before as well. And we're making sure that we get it done not just today, but we're going to not accept the status quo as well, and have a lot of innovative and creative ways to build not just the healthcare system we need today, but for tomorrow.
And back to the Premier. Last week, Toronto Mayor John Tory said the municipality needs more funding, more support from senior levels of government to overcome their budget shortfalls, mostly caused by the pandemic. Will you commit to that? And will this continuation of the gas tax cut into what municipalities receive for transit funding?
Yeah, I talk to Mayor Tory almost on a daily basis. Spoke to him yesterday, day before, the day before. We're in a clear understanding his requirements, along with all 444 municipalities. Just to put this on the table, we spent $1.3 billion more or given 1.3 billion more to Toronto than the federal government has. I think the federal government needs to step up and make their contributions as well to support the municipalities, be it Toronto or other areas. We have done more for municipalities again than any previous government I can think of. So we're supporting them. We're going to continue to support them, but we do need the support from the federal government.
Hi, Premier. Andrew Brennan, CTV.
Hi, Andrew.
Like Cynthia, I do want to not say we're not acknowledging what is being done and will be done when it comes to the healthcare network. But
Sure.
These are changes that, one, it's taken years already, and it will take more years for a lot of the structural, infrastructural, and network-wide changes to take effect. So right now, when we have people like hospital CEOs who are saying we should wear masks, and there's going to be an announcement from the Chief Medical Officer of Health that we should wear masks, why do you think, as Premier, this is not a time to do something beyond? If we have to wait for a lot of the changes to happen, right now, one of the big things we could do is wear masks. Why is it not? Why are we not having a mandate versus putting a recommendation in place?
Well, I've always listened to Dr. Moore. I'll take his recommendations. Again, we have a great team. I'll repeat them again. Dr. Zahn and Matt Anderson, Dr. Simpson, Dr. Moore. They'll be out tomorrow speaking to the people. I'll take advice from Dr. Moore.
A second question. You brought up Quebec when it came to using the notwithstanding clause. Now, Quebec routinely used the notwithstanding clause when it came to language issues, and it did upset quite a few people, namely the Anglophone minority in Quebec. But look at something like Bill 21, which you have said that you totally disagree with, but because it's under having invoked the notwithstanding clause, it can't be challenged on a charter capacity. But people have disagreed with it. Can you understand the frustration that others have with using the notwithstanding clause, or at least implying to use it, and think because they disagree with what you're doing?
Sure. Well, first of all, I don't meddle into other provinces' jurisdiction. That's up to Quebec or any other province that decides to use it. But what is more concerning is we had a tool, and QP went on strike. So our goal is to make sure the kids are in the classroom. That's my single most important goal, to keep the kids in the classroom. And what's more devastating than the Section 33, I'm not hearing from the media, is going on strike, keeping the kids at home, being dumped off at the grandparents, employers calling up saying we need the people. I think that's a little more serious, in my opinion. It affects the whole economy. So let's focus on getting a deal. Let's focus on keeping the kids in class. That is the most important thing right now to this province.
Good morning, Premier, and
Good morning.
others bearing the cold with a little less insulation. I'm Charlie Pinkerton of Queen's Park Briefing. Premier, if QP gives another 5-day strike notice, what are you going to do?
Well, hopefully they aren't going to. I can't answer hypothetical questions. Again, the media has asked me not to get into the weeds of this. And we're going to continue working with them to get a fair deal for the students, the parents, the workers, the educational support staff, and the employers as well. So let's all hope we get a deal, and we're going to work hard. We're going to stay at the table until we get one.
And before you were summoned to the Emergencies Act inquiry, you and Sylvia Jones had given a tentative no to appearing to testify. Are you willing to completely rule out 100% that you will appear to testify, no matter what is said in the appearances by others, including Prime Minister Justin Trudeau, before the end of its work?
Well, again, I'll repeat it for a 100th time. This is a federal government's issue that called it's a federal inquiry on the use of their act, the Emergency Act. So, again, the inquiry is going to continue, and I'm sure they'll be finished off in a little while, and the findings will come out.
Hi, Premier. Amar Khan with Global News. The healthcare system has been beleaguered for several months. to your own admission. We're hearing mask recommendations are being instituted tomorrow and will be recommended. And pediatric beds, as my colleagues have mentioned, are at capacity. Airborne illnesses are running rampant. And you're deferring, obviously, to the Chief Medical Officer of Health. But this is a tool that's in your capacity to bring mask mandates. Why not institute it? Why not use a circuit breaker?
Again, right from day one, all the way through the pandemic, I've always listened to the Chief Medical Officer of Ontario, and I'm going to continue listening to Dr. Moore, and we'll see what he has to say tomorrow.
How much more can the provincial healthcare system bend before it's broken?
Well, again, we're throwing every single resource we have, and this isn't unique to Ontario, folks. This is happening right across North America. We're seeing this. It's going to be a bad flu season. That's why I encourage everyone to go get a flu shot, get your vaccination as well, wear a mask where possible, especially if you have respiratory problems. That's the key here. So let's stay safe. Continue washing your hands. Let's go back to the basics of what we did throughout the pandemic, and the reason that all Ontarians perform so well. We've been through this before, and we'll get through it again. But just stay vigilant. That's what I ask, and we'll get through it because we have the best docs, the best CEOs, the best nurses and healthcare workers anywhere in the world, and we're piling the money into healthcare. Again, unprecedented amounts. We're hiring at unprecedented amounts, no matter if it's the nurses or if it's the doctors graduating or the PSWs. We're hiring 27,000. These are staggering numbers. We have 29,000 nurses being trained in the hopper right now, on top of the 14,700 nurses that came online. So again, folks, we're going to throw every resource we have, but I have confidence in the healthcare workers, be it the doctors, nurses, PSWs. We have a great team out there.
Thank you.
Thank you so much.